So hi everyone, my name is John Marcasano and I'm with E-Ink. If you're not familiar with E-Ink, feel free to stop by our booth, but we have a wide array of healthcare devices, displays that can help you in your practice or your hospital. But please, again, stop by our booth to see it. It's with my great pleasure that I'm welcoming our next session today, which is a panel that will address DEI, Diversity, Equity, and Inclusion. This session will be moderated by Andrew Marshall, MD, Associate Director of the Office of Ideas at Brigham and Women's Hospital and Harvard Medical Center. His mission is to promote better patient outcomes and health equity through the integration of healthcare, technology, and clinical care. Please join me in welcoming Drew, who will introduce our panel.
Thanks so much, John, for the kind introduction. It's a real pleasure to be introduced by somebody that I consider a friend. We've worked together for a bit now. I want to turn it over to the people that we all came to see today, which are the panelists. And I want to start on the end over here and give everybody a chance to introduce themselves, give us their name, tell us where they're at, and tell us what kind of work that they're doing in DEI.
Hello, everybody. My name is Kirby Valentin. I'm the Grants and Contracts Manager and DEI Lead at the Massachusetts League of Community Health Centers. And my work surrounding DEI involves leading our DEIB work group at the Mass League, as well as leading our employee resource groups. We also do DEI discussion groups monthly that I lead. So that's a little bit about my role in the DEI space at the Mass League.
Good morning. I'm Wendy Hoffman. I'm the Chief People Officer at Divurgent. We are a national healthcare consulting firm, and my role with DEI is not only internal with our workforce and recruiting, but also how we service outward to our client through our service and solutions.
Hello, my name is Latrice Landry. I am an instructor at the University of Pennsylvania. I work specifically in the area of how we build or integrate equity into genomic learning health systems and how we can translate that to better patient care.
Amazing. So I'm very excited to kind of help moderate this panel. Really excited to learn from you guys. We often talk about diversity, equity, and inclusion, DEI. I want to take a second to allow each of you to tell us why diversity, equity, and inclusion are important in your line of work, and maybe give us your brief definition of what those terms mean, since I think we tend to throw them around a lot.
Oh, Andrew, you want me to define diversity, equity, and inclusion, so I feel like I just got asked an exam question. I'm trying not to fumble on this. So in my space, I specifically work with genomic biomarkers, and that goes into areas like precision medicine, targeted therapies, diagnostic assays. And one of the things that we have found, and we started with this question when I was working with the FDA, is specifically, do we understand how these targeted assays, how these targeted therapies work in non-white populations, specifically because so much of the research has been focused on predominantly populations of predominantly European ancestry? And the answer in every space that we have looked at is that the assays and the therapies work less effectively. And you cannot assume that just because you had this great clinical trial, if the clinical trial lacked diversity, which I'll define as diverse persons of diverse demographic characteristics, demographic and geographic characteristics, that it will work the same way. So why does it matter? Is because it impacts our clinical yield or clinical utility of all of the assays and targeted therapies that we've looked at. And what does diversity mean? It means people from different geographic and demographic backgrounds. And what does inclusion mean? Inclusion means having a seat at the table. And what does equity mean? Meaning that we give the right tools and the right fit for the diverse participation so that everyone's not getting the same thing, but everyone's getting what they need to have that seat at the table.
Thank you so much. For me, I'm coming at the angle as the Chief People Officer as an employer. Divurgent is a consulting organization. We are in healthcare. And as we recruit and hire and bring individuals in, it's very important to us that the way that we can be our best is through diversity, equity, and inclusion. So through that, not only is it from an employee basis and a recruiting basis, but as I mentioned, as a consulting firm in healthcare, we certainly have a need to bring our best capability and services to our clients. And having that ability means that we use the tools, the analytics, and we assess where, what, why, and how across our business practice, our capabilities, our services, and be able to add value outward to our clients. For us, similar, diversity definitely means bringing those different elements to the table, from a conversation, from a solution, from a capability, from a research, and having that collaboration. From an equity perspective, we want anyone and everyone to have a voice and an opportunity to be equal in that conversation. And certainly, we all appreciate inclusion. We value being able to share and sit and evaluate. So through that, it's kind of a trifecta approach of, one, is the individual that is getting employed, two, we as an employer, what can we offer in service, and three, what goes out to our clients.
So at the Mass League, we do work to support community health centers in Massachusetts. And in the state of Massachusetts, 67% of the patients that community health centers serve identify as racial or ethnic minorities. So at the Mass League, we feel that it's very important that the demographics of our staff reflect the demographics of the patients that we serve. And ultimately, communities of color in this country have faced significant disparities historically. So to me, DEI is all about bridging those gaps and bridging the gaps that other marginalized communities in this country face as well.
Amazing. Thank you to all the panelists. I'm going to actually send this one right back to Kirby, since he was a gentleman, and let the ladies go first in the last one. In what way can organizations collect and analyze data on DEI to gain insights into the experiences and perspectives of underrepresented groups?
Well, to answer that question, I would say the first thing to do is to really assess the demographics of your organization. So at the Mass League, we use our payroll system in order to assess our demographics. The payroll system we use is ADP. And once you have the demographics of your organization, you can then cater your DEI programming based off of the way the marginalized communities in your organization are represented. So for example, at the Mass League, we saw that we had a rising amount of staff that identify as BIPOC, which is Black or Indigenous or people of color. So when we saw that trend, we decided to create a BIPOC employee resource group. And we've also always had a large amount of women at the Mass League, so based off of that, we created a women's employee resource group.
Very similarly, we use our HRS system, it's Paycom, and as individuals come into the organization, they have an opportunity to designate. And we also, as administrators, from a TR, HR perspective, have access to those that didn't supply data. So we have an opportunity to encourage them or resend that opportunity and see that vacancy of that data so that we know. From a recruiting perspective, we have the ability to source and identify and use other capabilities through LinkedIn, Indeed, other sourcing mechanisms to bring that diversity to our candidate pool when we have open positions. And then we also have, through our clients and through those business solution opportunities, when we're sitting at that table in conversation and discussion, what data elements do they have to bring to the project team or the outcome or the solution that we're partnering with?
So I come at this from a very different perspective in that I'm working with, in learning health systems, we're working with electronic health records data of patients, and we're trying to assess the demographic and geographic diversity of our patients. At the same time, we're having this shift in genomics and this cultural conversation that's being governed about how we think about and characterize different groups and what language we use, right? So we're at this space, and I'm looking, we all use billing systems, we all use the sort of checkoff boxes. At the same time, I was at a conference recently where we were told, you know, we shouldn't classify people as by census data classifications because in sort of the work that we're trying to do, it may not be the classification that has the most impact on a health outcome, but it's the one that's used the most, right? And so should we even use race? So we're at this conflict of space. Truthfully, we still use the EHR systems to sort of look and examine who are our patients, who are the demographic populations, how can we characterize them, but it's limited.
Yeah, that's some really good insight on how you guys collect data, view data, and some of the generalizations about strategy. I would love to drill down into that a little bit more, and see if any of you guys can give us some practical examples of data-driven approaches that have been successful within your organization to improve DE&I.
One of the items I didn't mention in my previous answer is we survey our team members quarterly and twice annually to collect information and engage. And this may fall more in the inclusion side or the equitable side of the equation versus diversity. But ultimately, we want to understand, have a transparency and a way to collect that information and data. And then we have a culture club, which is a representation of every department across our organization. And the culture club uses that data from the survey to say, how can we engage? How can we include? And as a full remote organization, we have no corporate office for our element in our operations. What kind of programming do we install and embrace? So an example right now, it might seem interesting or a little off, but we have Name That Tune going on through a Teams channel that we get every day an opportunity to participate and engage and learn. And through that, people start to share something. That's my favorite song. Oh, that song's in my head. And it's a way that it brings new people to the table. Through that same survey, we incorporated virtual coffee breaks. And so we have those at different times. And across our consultant base or across our team members, they start to join those coffee breaks. They hear about it. Maybe we play a fun game. Maybe we have a key topic. But that inclusion, that involvement, that participation at a remote level makes a huge difference across our culture and our capability that we get to know and learn from one another, and connections are made. Oh, you were from here, so am I. And that starts a dialogue across our work activities that bring greater value to what takes place.
At the Mass League, we're very big on doing surveys too to determine the type of DEI programming that we should implement. So when we first started doing DEI work at the organization, we sent out an initial survey to determine exactly what staff we're looking for from our DEI work, and we ended up finding out from our staff that they were looking for us to implement DEI training. So that was a big reason why we implemented DEI trainings at our organization.
I think even in our space, the surveys wind up being a very effective approach. So I come at this from individual institutions across sort of genetics, clinical genetics. We've had the same issue of a lack of representation and inclusion. So very few persons of color or people who identify as BIPOC are in our workforce, and that is an issue that just needs to be addressed in some ways that an individual institution can't address it itself. So one of the strategies we've employed or is currently being employed is sort of working through our academic organizations like this, where you have people across different boards. And so what the American Society of Human Genetics did was sort of reach out through surveys to all of their members and try to identify program directors for training programs, try to identify department chairs and different, and also work with the individual companies who play a major role in our society, and try to see and reach out to identify what were the numbers or sort of representations in those groups. And then what the American Society of Human Genetics did was say, we're going to create a group, an affinity group that is meant to build capacity. As a society, we're going to support this. So it's not going to be institution-based, but it's going to be society-based. And we're going to provide resources and partner with our industry partners to identify what are the needs, and this comes through the survey, of our underrepresented minority, both in disability, minority status, as well as sort of social, economic, and sort of filling out certain demographic characteristics to support their development within the society and within their careers. And it's been really effective. So that group has a space now within the American Society of Human Genetics. They meet, they convene, and they're able to sort of impact and affect change within the organization and then bring it back to their individual institutions.
Amazing. So there's some common themes that I'm starting to hear, which is, talking to your employees, getting surveys, or the people that you may work for or work with, patients even, is an important part of this process. But are there any challenges or limitations that might arise when you're using this, when you're collecting this data, or when you're using this data to kind of inform your strategies going forward? And part two of the question, if you're up for it, is how can these challenges be addressed and overcome?
I can address that from 2 points. So where I sit, we're sort of working at the workforce diversity, but we're also looking at the diversity of patients and how we include more patients. One of the things we've realized on the patient side is many of our institutions or in the hospitals that I've worked at are directly in sort of neighborhoods where you may say that those neighborhoods are demographically diverse. But the patient population within the hospital is not. And so we have patients that come from far, all over the world, but not the patients who live right outside that come. And so one of the issues, for instance, in a recent sort of strategy or sort of exploration of this, was that patients right outside the hospital in those communities didn't feel that our major academic research center was for them. They didn't think that the providers would understand them, could relate to them. They didn't see themselves as being a part of it. So the key word I have here is engagement, right? So one of the things that has been important is to engage those communities and really try to understand what are the barriers they see to actually receiving care there. And sort of that level of engagement has been really powerful to sort of understand that even though you can have a great product and the healthcare that you provide, there are still barriers that people perceive to receiving that product. And rather than sort of just assume that they aren't interested in receiving that product, but be able to engage them. And so we have community partners as well as individuals who are staffed by the hospitals who focus on sort of engaging the communities and really trying to understand community perspectives and barriers and facilitators to receiving care there. Now, on the workforce side, I think that one of the key things, it's been a similar thing. So in the example of the American Society of Human Genetics, one of the issues is a lot of interest in sort of, and on the discovery side of genetics, sort of working with smaller populations, indigenous populations, founder populations. There was a huge barrier where people felt that they were being recruited to be a part of something just so they could recruit patients that looked like them, right? And so part of, again, in that word of engagement comes up more. So what can an organization do to engage a community, understand their concerns, and address their concerns so that it feels more of a collaboration or a partnership and less of a give or a take and take relationship?
I'm going to answer the second part of the question first and then come back to the first one of the challenge. But I think education, resources, and tools are a key element to a successful understanding, especially within a workforce. So we provide, as part of our standard annual compliance training, workforce diversity as one of those programs that they go through and get. So by establishing that as a core foundation of somebody's knowledge, skills, and going through that training, and it does have a quiz at the end of it. So it is something that provides them with that baseline. And then through having a policy and leadership and direction, that our actions, not just words, make a big difference in that implementation. But the challenges that sometimes come through are you bring individuals. Consulting is a people business. That's what our skills, knowledge, and ability is what our client brings. We don't have a widget to sell. We have individuals' capabilities and knowledge. So what everybody comes in is a very different platform, and trying to equalize that platform and understanding and contributing and gaining from the very different components that come in to that employment workforce is probably one of the key challenges. It's just kind of equalizing that and being able to take advantage and make the most of that as an opportunity and not as an issue or a roadblock. But I think the tools, the education, the resources, and really the investment that you own as an employer makes a difference.
I would say at the Mass League, one of the biggest challenges we face with our DEI data is probably like the response rate on some of our surveys. And the way that we've addressed that is just by consistently sending out reminders, to make sure folks complete those surveys. And also, as I mentioned, we've been using our payroll system for our demographic data, and we found that to be very successful. I think anytime you're connecting surveys with payroll, people are more likely to pay attention. So,
I love that. It always follows the money, right? So a couple of you guys mentioned missing data a little bit. We mentioned sometimes people don't fill out the surveys. How does missing data impact the work that you do? Latrice, to you specifically, how does it impact research and patient care? And what are some ways to correct for this missing data?
Yeah, so this is the space or the focus of the work that I do is the issue of missing data. And so what happens in genomics is we do all this research to understand a target. We create a test to evaluate that target and develop treatments for that target. And then we roll that out into a patient population. And all of that process is involved and it costs a lot of money. But when you do the entire sort of clinical trial research process, in a convenience sample, and that convenience sample winds up coming up from a single demographic population, what we find is that all the test, the treatment that's developed, all of that cannot work as effectively across all populations. So you have this issue of the missing data of who you didn't include in the research studies, not just in the discovery, but also in the clinical trials where you're looking at safety, where you're looking at clinical effectiveness. And so it winds up impacting the entire paradigm of our sort of precision treatments and diagnostic assays. It's a huge issue because what you wind up offering the public is something that works for some but not all. And in 2015, there was even a article in the MIT Technology Review that said, white people only DNA test shows how biased research has become, right? And so essentially this characterizing the story where certain diagnostic companies were offering a test that said for white patients only, right? And we know the optics of that looks and sounds really bad. With the diagnostic company, and what a lot of people are concerned about is we have something that we know works for some patients, shouldn't we offer it to them? And then what others say, well, you have something that works, but you actually have to, the physician, the providers actually have to sign off on, I'm only going to offer this to my white patients. It's such a hard thing to try to sell. So that's the issue, that's the challenge. How do you overcome it? Well, most of the field is really focused on we need more diverse samples and more diversity in research, and that's important. But you have to imagine that we are finding now, for instance, even things that we thought were true probably when Dr. Marshall was in medical school and things like that are now becoming not true for everyone. We're not going to be able to undo that century of research in a quick file snap, and so we have to figure out more innovative ways. So what we're trying to do is incorporate AI and machine learning, and so part of my work in looking at this in a learning health system is how can we employ some of the things that we know, how can we leverage data and algorithms to help us understand where there's a lack of generalizability and where there's sufficient generalizability to move forward. So I think that answers both your questions.
Yeah, and just flipping a little bit, how do you think that missing data affects employees?
Yeah, you want to go? Okay. For us, I think one of the important elements is that individuals on my team have this as a priority. So it's our role to onboard and bring people into the organization, and that they have an opportunity to opt out, but at least a selection is made versus no data. So when we have that information and reporting that tells us monthly that a field or an element or a data value isn't there, then we can follow up and go and send that link out to reissue it and try to solicit that information. So we have as much complete information when I do my reporting at the board level on a quarterly basis. With our surveys, we really try to make it clear and known and use platforms that is anonymous. so that they can truly share what they want. If they want to disclose who they are, fantastic. That gives us an open door to have a conversation, but ensuring that we make sure that that's anonymous, gathering that information in detail so we can use it as business, leadership, or operational choices.
I would say that missing data definitely is a tough challenge to overcome, because in this space you're constantly trying to build like a business case for DEI. So when you have missing data, it does kind of hurt that case a bit. But I would say the best way to kind of overcome that missing data is to consistently send up follow-up surveys in order to collect more data.
Yeah, I think you brought something really important, which is the business case. And so we're going to come back to that in a second. But so you've gotten your surveys started, you've gotten your DEI initiatives going. How can you ensure that these data-driven strategies are implemented correctly and sustained over time? And give us some techniques for measuring the progress and the success of these strategies.
Well, for us, I think first and foremost is we have support at the board level, we have support at the executive level, and we have support at our management level, that this is something that's important and critical in our organization, and it is viewed and valued appropriately. So by reporting, sharing it on a frequent basis, and allowing that data to be visible and create conversation and allow for analysis of where can we improve, what do we need to do different, and where are we falling short. We certainly are not perfect. We have areas that this is still a very key element from a diversity perspective at our board level. We also have an advisory board that serves as a place for us as a consulting firm to kind of bounce those ideas off of, to understand where we are in the marketplace compared to our competition. And that advisory board gives us an opportunity so that diversity, that equitable component and inclusion is valuable there. So we utilize them as a resource for information and knowledge and that balance appropriately. So I think first and foremost, it does need to be a known element across the organization at all levels. And second, it's not something that just shows up on a report on whatever cycle, once a month, once a quarter. It's actions, it's behavior, it's bringing it forward, it's having the conversation. And we utilize some of our other external social media, blogging capabilities. We also have Teams channels that educates in various ways of different interest groups, different cultural backgrounds, ways that we can get information out and make sure that it's present as much as possible on a daily basis, not just on a reporting basis.
I want to echo something Wendy said earlier, because I think that we try to tackle this in the same way we tackle other things. It's had to make the case for that, right? So the idea is that we have a program design, and how do we tackle everything else? And Wendy mentioned education. I think education is the core, right? So you can't hold an organization, an institution, or individuals accountable if everyone doesn't have the same baseline knowledge and appreciation of what the goals are. And so incorporating equity into the educational materials has been important. So as a part of, for instance, our responsible conduct of research, they've now dedicated almost across most of the institutions that I've been a part of or work with have required to focus on equity, inclusion, and diversity as a part of their understanding. For everyone who has to do research has to sort of do these trainings, and so to be able to work with human subjects. And so it's a part of those trainings, right? So the idea is that you penetrate the entire community doing something they already have to do. They have to do these trainings. They have to do it on a sort of recurring basis, and incorporating equity into those responsibly handling human subjects research trainings. Secondly, once everyone has the program at hand and understands and has been trained sufficiently, then I think it's appropriate to have a detailed monitoring and evaluation plan. I think sometimes we implement things and we forget the monitoring and evaluation. We get all the excitement of the success of the implementation and the launch, but then, sort of the messy, boring part of just monitoring and evaluating and make sure it's performing adequately is really important. And having that as a part of the plan to monitor equity and evaluate it over time is an important component. And I think that one of the things that we've been trying to do, again, is how do you do that and build it into a system that already occurs within your organization. So one of the things we're trying to advocate for is equity as a QA/QC metric, right? And so in a lot of hospitals and a lot of research and a lot of things that we're involved in, and QA/QC is already a part of it, right? And so where could regular monitoring and evaluation happen? It could happen as a part of a QA/QC, right? And when there's ways in which we can use technology and sort of our algorithms to do that for us, but we have to be committed to doing that, and there has to be stakeholder engagement and commitment to valuing equity at that level.
I would say that it's very important to utilize the data that you collect. It's one thing to just collect data, collect feedback from staff, but you have to actually use that data to adjust the programming, based off of the feedback that you're receiving. Otherwise, staff will be less likely to even complete surveys if they feel like they're not being heard and we're not adjusting, our programming based off of the data and the feedback that we're receiving.
That is so true, that you've got to use the data you have and the feedback you get. If you don't take action, if you don't use it, you don't demonstrate that it matters, then you lose the credibility to continue to collect data.
That's an excellent point. Excellent point. So you guys have given us some fantastic examples. I think the last question has to do with kind of not just sustainability, but how do you present this data in a way, because every initiative can go in two directions, right? So you can either have a fantastically successful initiative, or you can have an initiative that says, okay, there's more work to be done. How do you present that data to your stakeholders in order to get additional funding to continue to do what you guys are doing?
For us at Divurgent, I have a platform at our board level on a quarterly basis to be able to share our information and data, to own and be accountable and responsible from our employee culture, turnover, retention, recruiting initiatives, and every aspect. And it's an open forum and an open opportunity for that conversation and to discuss where, why, how we move forward differently. We also have the platform through conference calls for our Divurgent huddle and our team meetings, as well as our cultural compliance elements, where we share that data back out to our team members. So for us, it's at all levels that are essential and necessary to make known the information and the capabilities, and we see our stakeholders greater than just our board. And as a result of that, we get that inclusion and that involvement, we get that participation and trust, and we continue to work on it as we move forward.
I would say on the research side, this is a sort of a pressure point. I think we had areas of research that have routinely done stakeholder engagement. Implementation science is really well known for it. This whole idea that we're working with community partners, that we identify stakeholders, both institutionally and community-based stakeholders, and we implement what we do, and we get feedback from them. But there are whole other areas of science where, I'm a scientist, I'm just doing what I do, right? And don't ask me about it, and you should be really excited because I've discovered something great. And I don't mean to say that, I'm sort of portraying like the worst case sort of idea of what a scientist might be, but I think that it's true to say that there's certain areas of science where they're not used to feedback. Engaging stakeholders is not a part of the practice of that type of science. And so what we've had to try to do as a community is have all of us understand the importance of engaging stakeholders, the importance of who our funders really are, and understand why we need to sort of have these conversations and teach the skills for a stakeholder engagement. And so right now what we are doing is sort of creating spaces where more of the workforce can engage in the skill sets that are not the necessary to be successful in engaging stakeholders and bring about those impacts. And I think that is the type of thing that is different than sort of, Divurgent's a company, they've already sort of built on doing this platform, but this is new for us, and I think this is going to be pivotal in sort of moving the field forward.
I would say that it's important to provide context for data, because a lot of times if you present data to people and they're not directly involved with the work, they're not going to really, fully understand it unless you provide an explanation of it. And I think it's important to also paint a picture, with the data that you provide. You don't want to just provide like the raw data. It's good to show charts and show graphs and provide detailed explanations along with those charts and graphs.
Totally agree. Context is always good. I actually want to take a second, because I've taken a lot of notes, to open it up to the audience to see if the audience has any questions for our panelists.
Hi, thanks. My name's Irene. I'm from Boston Children's. Question for Wendy from Divurgent. You said your company is fully remote. That's fascinating. And I guess my question is, how do you get that engagement from just your employees? And are there patterns, trends? Is there more engagement from people of color, minorities, or is it really just the white employees? I'm fascinated to find out, how do you even get that kind of level of engagement, especially coming out of the pandemic, having Zoom fatigue?
Yes. So Divurgent is and has been remote. I've been with them for 7 years. So this even before the pandemic. And I personally have been remote for 25 years in healthcare, both from a hospital background as well as consulting. So I just share that for qualification and clarification of that. But what changed for us is our consultants weren't on site at the hospital sites as often as a result of the pandemic. And they shifted to a more of a remote onto hybrid as we kind of evolved back in. So from an engagement perspective, that's a huge priority for us to do. So I think it's a combination of business work, tactical, operational principle kind of work in teams, but also fun. You've got to bring an element that brings people to the table for different reasons. And I know many of our leaders ask questions at the start of their conversations with team meetings that brings a dialogue to the table different than just the project and different than just the work activities and elements. So that's one area. Second, it needs to be consistent and repetitive. You can't give up because you tried once or two and you didn't get the participation that you were looking for. And you need to ask for the feedback. You need to know, what do you start? What do you stop? What do you continue? What is being avoided? What's not working? So that you can make those adjustments and ensure that you're hitting that audience. And for us, for example, it's more of our billable consultants who are out in the consultant field working with our clients who aren't in an administrative or a management or financial type role or position that we need to connect with more, where they're making those connections at the client site, where they're engaging in the initiatives to why they've been asked to participate and help that healthcare entity. So that's where we really make a difference in utilizing our infrastructure. So we have principals, we have directors, we have managers, we have leaders, and we utilize all areas across the organization. They're not silos. So I can have conversation and dialogue with individuals. The finance team can, and it's not just one area. So in elements of time, those are a few examples I would share.
I guess for when you're talking about kind of surveys as being one of the main points that you receive this information from employees, I guess, how have you guys navigated making sure that employees from underrepresented populations don't feel like tokenized, I guess?
I think one of the things, I can say this from our society perspectives, we've had a lot of deliberate conversations about this, and I think that one of the key things that helped us get past that is when it stopped being just a survey and it started being consistent and intentional engagement. Because I think once you have that conversation, once there's a space where these things are being, where people feel like they're being engaged, they're being heard, then when they receive the survey, right, and they feel like they've helped inform the survey with the things that they feel are maybe things that might make them feel more tokenized, then they're more likely to participate and more likely to respond. I think often there's just a sort of a balance that is not being met in terms of how people feel and they're being received, and the intention behind that. And so I think that what we have used is engagement, really trying to have sort of focus groups, question and answers, times where people get to sort of air and just speak freely, and then tell them we're using that information to help better, build better communications. And then we found that the response is different once they've been able to help inform it.
To me, I would say the main way to kind of prevent people from feeling this, tokenization feeling is building psychological safety within your organization. And you can do that directly through your DEI programming. So some of the ways we do that at the Mass League, we have monthly DEI discussion groups that we do. We have the employee resource groups that I mentioned as well, and these help create a sense of support for marginalized communities within our organization.
Thank you. In the interest of disclosure, I have the privilege of working with Wendy at Divurgent, so just so everybody knows. It's sort of related to the last question. I'm curious, do you run across situations where individuals are reluctant to provide data that you're looking for, out of concern of being marginalized or being, whether it's tokenized or whatever? Do you run into that sort of an issue where, folks just, I don't want to disclose my ethnic background. I don't want to disclose, various factors about me.
I would say absolutely. I think we have this issue. I live in a space work in a space where we're in two worlds, where everyone shares everything, right? That's one part of the population. The other population is like, I'm not giving you anything. And I think that one of the things, to sort of go back to what Kirby was saying in terms of that psychological safety, I think engagement is a really great tool to help build that safety, being able to talk to people. I think the reality, the essence of what we're talking about is trust. Do people trust you? They do trust what you're going to do with their data or whoever you may hand their data to. And trust, I think, is something I've only really seen overcome with sincere engagement and sort of all the approaches that you might use in your DEI programming.
Yeah, I agree completely, and I'd only add in that component is you've got to build that trust with the individuals. So explaining the why, the what, and where it's going to be utilized can really help sometimes in being able to either get that data from them the next time or get them compliant with participating because they hear that what, why, and where.
Exactly, yeah. I think it's very important to explain to people, why you need the data, the importance of the data. And I think it's also important in general for your DEI brand at your organization to be based on integrity, to make sure that people know that you have the best intentions.
Well, that was amazing. Before we wrap up, I just want everybody to give a round of applause for our fantastic panelists. And I want to emphasize a couple of themes since we are here at Himss. We're all thinking about building health technology. But one of the themes that I heard throughout all of this, and we're going to go through 6 of them, one of them is inclusivity, right? So you want to make your employees feel welcome. You want to make your patients feel welcome. You want to make them feel like they're part of an environment where they can meaningfully contribute. We heard the theme of inclusivity and diverse workplace to maximize effectiveness. Transparency. We talked about collecting the data, but we also talked about letting people know like what's happening with the data, making sure that we're using the data. We talked a little bit about making sure that reporting of the data is anonymous, so we don't tokenize or make anybody feel, more marginalized. And while we didn't say the word bias in this panel, it was alluded to several times. And so we talked a little bit about, how data, if it's incomplete, can misrepresent a certain population, how humans inherently have bias a little bit, and how we can hopefully, course correct our technologies to make sure that they don't have the same bias in them. And then, privacy and security. If we're dealing with patients, we want to use informed consent and let them know, again, what their data is being used for. And then earning the confidence of our employees was something that I heard over and over again. So earning the confidence of whatever group you're surveying, right? Like letting them know that the data that is being collected is being used for something meaningful. That way they can stay engaged, another theme that we kept hearing, and continue to provide the data that we so essentially need to course correct. And when we're thinking about developing technologies or providing a service or providing patient care, we should think about collaborative design, right? That includes not only just having employees that are diverse, that feel welcomed in the workplace, but we should think about like our end users and including them in the design of these products as well, to make sure that we have a product or a service or something that everybody feels like they can participate in. And last and not least, I think this is very important, and everybody talked about it, but evaluation, assessment, and course correction. So we talked a lot about how to collect the data. We talked a lot about how to present the data. We talked a lot about, how to get stakeholders involved with the DEI initiatives and to make them sustainable. And so I think part of that is doing monthly check-ins, bi-monthly check-ins, like Wendy alluded to make sure that your initiatives are moving in the right direction, frequently looking at the data, and then if you need to make a change, making sure your stakeholders are involved and kind of ready to support you in making this change to get the outcomes that you're looking for. So I want to thank the panelists again, and thank you all for all of your attention. This has been fantastic. I've learned a lot. I hope you all have as well.